I've developed a training package that's largely based around the Australian Childhood Foundation, ACF's training that they've delivered to workers and to teachers, and I've adapted it for foster carers. And there's been two parts to it, and last year I delivered some of that, which was around theory behind trauma for kids and how it affects them. And what I wanted to talk about today was how we apply that and setting up what the ACF have as a model called practice. It's the letters of the word practice that breaks up into a framework on what we can do to assist kids with trauma. The understanding of trauma is really important to work out how to work with children with trauma, because it's children with trauma, normal parenting doesn't work with them. And I think an understanding of that then helps to develop better strategies with them, but more realistic understanding of how they're going to learn and what their reactions are. So part of the initial part of the training was around that sort of the theory or the understanding of how trauma affects memory, how it affects arousal, how it affects feelings, how it affects relationships. And with that understanding then we moved into a second phase, which is really then looking at this model developed by the ACF on how to apply that understanding in dealing with kids and young people. Just a few things about the handout. There's a huge amount of information in here, and it's information that takes quite a long time to read through and assimilate. Even for me, developing the training, there's a lot of learning that I took on every time I went through and started to read it even more. The other thing to be aware of is we're planning to adapt this to an online training, into online training modules that will then be self-paced, so you can take it at your own time, sort of thing. And what we're hoping to include in that is online forums, ask the experts. So if you've got any questions, you can send a question, we can respond to that as well. So because I'm really aware that face-to-face training is not a great learning environment. You learn on the job and understanding things and then applying them, and that's why we're trying to move to an online format of training where questions can be asked and learning can continue over time. So in part two, the first couple of pages covers like a summary of some of the key factors that we're aware of with kids with trauma. And the first one is that their baseline levels of arousal are already high. It's understanding that from the start they've got a heightened level of arousal, which means we need to be very closely attuned to their mood, to focusing on adjusting sensory stimulation, meaning watching that don't get overwhelmed by noise or different things that puts them into a flip the lid state, that they feel safe to connect, and the environment is predictable, because predictability is a safety or security factor, I think, for kids with trauma. The second factor there, it's in psychological speak, but what it's really saying is that when someone is triggered with trauma, the thinking brain closes down and the primitive fight or flight response kicks in. And at that time, children aren't listening, they're not learning, there's no point in teaching or telling them at that stage. Because if we don't understand that, then we're trying to communicate with them and actually maybe fostering a greater level of fear on their part rather than trying to reduce their arousal. So one of the key factors in this working with kids with trauma is that when they flip their lid and their arousal goes sky high, the number one aim is to bring their arousal down. Not to try and teach them what they've done wrong, or apart from if there's a level of risk, and we're trying to minimise risk, because there's no point communicating or assisting with them until the arousal comes down. And sometimes it's not obvious. Sometimes the kids can be in a fight or flight response where they're aggressive, but some children go into a freeze response. And a freeze response is high arousal, but they've just gone, and so it may be the lights are on and nobody's at home, sort of deer in the headlights look. Again, it's being aware, okay, I think that they've triggered, and I need to be aware that the first step is safety and security and helping them bring their arousal down. There's no point trying to communicate with them. And I guess one way to think about it is, if you've ever had a panic attack, or you've ever been in a situation where you've felt threatened, severely threatened, then it's being aware, okay, the thinking brain isn't working at that stage. And people might even be talking to you and you might not be hearing them. That's what's going on when they get triggered. So it's understanding that, not that they're choosing to be aggressive, but that they're being triggered into a traumatic response caused by previous experiences for them. So that when they're in a triggered state, they're not able to reason, and there's no point in trying to teach them or tell them stuff. And what it also reflects is a lot of these kids and young people haven't got the ability to manage stress at all, or very little stress. And part of the task is to help them become more resilient and manage stress, manage situations where it doesn't go exactly the way they want, or where they've said no to something, or a change has to occur. The third one is, and it's something that has come out through research, is that children with trauma don't have a dysfunction with their memory, in that they don't bed things into their memory in a chronological order. So the issue with that is then they don't remember things, and so often they won't remember patterns. They won't remember that yesterday in the playground when I asked this girl about her mum and she got upset, the next day he might go back and do the same again because he hasn't remembered it. If we tell someone to do something, if they don't remember it well, the next day they won't remember it. And so there's techniques around teaching kids and young people to process the day and bed in memory. Because without memory, there's no learning. We learn from patterns, we learn from predictability. We learned that yesterday this happened and last Tuesday the same thing happened. So if we don't have that memory, we don't have learning. So it's a new area of research looking at assisting kids with recalling the day in chronological order and helping them bed in memory. Because what happens is when a child is triggered, when the trauma is triggered, they experience the moment as if the trauma is occurring again. So they lose track of time and place. And that's part of the reason why there's this difficulty then with them remembering things in order or recalling things. And so if they don't remember things, it's imperative then that we have visual cues that prompt them to remember what's going on, what's the routine for the day, and there's a lot of repetition of what needs to happen. And that it's also knowing that routines will take time for kids with trauma to understand and to follow. So learning and memory are very dysfunctional for kids with trauma, and we need to understand that. Otherwise, the situation with children can be so highly frustrating in that you might think, well, I told them that yesterday, they should remember it. But it may be that they don't remember that, and we need to help them with their memory. Again, memory then impacts on their ability to develop social skills. As I said before, maybe with a girl whose mother is ill and I didn't realise, and I said something to her in the playground and she got upset. If I don't remember things, then I'm going to fall into traps with people. If I don't remember that someone wasn't nice to me, I might hang out with them again the next day and then they're not nice to me again. But somehow I'm not remembering it well and not realising, okay, I need to keep away from this person. So it impacts on a lot of different aspects of their life, of their behaviour and their relationships. The other thing to recognise is that the trauma response that children and young people present is a functional response, meaning it was functional for them at the time that the trauma was occurring. So a freeze response may be, well, I'm safe if I'm under threat, I'm safer to freeze and do anything and I mightn't get hit. A fight or flight response might be, I better get ready to run away because dad's after me or mum's after me. So it's also understanding that often the behaviour was at one stage functional or adaptive. It helped them. But unfortunately it's no longer functional, but they're not able to switch it off. And things trigger. Things will trigger their fight or flight response or this trauma that they experience. And one of the frequent triggering that I often talk to carers about is visits with biological family. It's a difficult one because often if a caseworker was observing, it was a supervised visit and they're observing, the caseworker might say, well, nothing untoward went on, nothing untoward was said. And I might say, that's very true, but it's highly likely that if the child who experienced trauma and neglect in the house, in the family home, is having a visit in the family home, that there's some sort of triggering going on. It's a difficult one because sometimes the department will not take note of that. They perhaps perceive the carer as being too personally involved and perhaps trying to restrict the child's visit with the biological parents. But it is a significant issue and it happens quite frequently, and it's an issue that needs to be addressed for the child's welfare. Otherwise, a common experience is a child coming back and then going into either an aggressive state or a closed down state. And as I said before, it doesn't mean that something big has happened. It may be just the environment that's triggering, but certainly tone of voice can be triggering, a whole lot of things can be triggering. Too much stimulation might be triggering as well. So if the access visit is mum and dad and 3 or 4 other kids, there may be an aspect of that that's stressful and triggering for the child. The difficulty often is to be able to communicate with child safety around that issue and for them to recognise this is going on and we need to monitor or assist in trying to minimise the triggering occurring. And as much as I'm talking today about training up carers and kinship carers in trauma, departmental workers need to have training in trauma, but also biological parents, because if they're not trained in the trauma, then they're not aware of what's going on either. But there's that lack of training that means that there's a simplistic approach to family visits and reunification, and then there's a lack of detailed observation of the children after visits and an assessment of how that's impacting on them. So that issue of triggering can be a very common one after visits with biological family, and it's really important that it starts to become made aware to the department, perhaps also talking to the child about what might be going on for them and what might be triggering. Because part of the learning in this package is for carers to become aware of aspects of trauma and understanding how children might be triggered, but it's also making the children aware as well. Because the more they're aware, the more they have an ability maybe to step outside their behaviour and start to recognise, okay, it feels like I'm under attack, it feels like I'm threatened, but maybe there's a part of me that also recognises this is a pattern, and I understand that certain things trigger, and so it might be, if I'm aware of things that might trigger me, I can be a little bit more prepared. So I'm going into this environment, so we know that last time we went to the supermarket, you got triggered. Now we're choosing to do it this time, and let's see how you go. But if he or she is prepared for it, there may be a greater ability to manage the reactions rather than be lost in the flip the lid fight or flight response. It's important to realise how significant trauma is impacting on learning and ability to change, and how no matter how much effort a child might make not to react in a certain way, when they're triggered, they can't stop it. So it's not an effort. It's not an effort thing that might feel like, well, I just told you not to do this, and you just reacted aggressively again. It's understanding when they're triggered, as I said before, the thinking brain closes down. They're not thinking clearly. There's not learning going on. They're not even listening very well. So that it makes it hard for them to change. And helping them change is about keeping arousal down and keeping them in a zone where they can listen and learn, and we can communicate, and we create stability for them, and we create connection with them. Because one of the things we're also aware of with trauma is that connection helps to stabilise. And a lot of kids with trauma in their backgrounds disconnect. They've learned to disconnect in a safety way, and they will block trying to connect often to begin with. But it's recognising that ultimately that connection helps stability and helps them stay in a safe zone rather than getting to a point where they flip the lid and react. Another factor to be aware of is that trauma also impacts on children and young people's self-identity. I explored it a little bit in this first part of the training package, but what we find is they have very negative concepts of their self and very negative concepts of themselves in relationship to adults. And trying to connect with a child is very difficult because they've stopped connecting with adults they know, let alone adults they don't know. And I think it's understanding how, not that the department would be willing to accept this, But if a child is removed from a family, it's traumatic. It's not just living with grandma for a couple of days or something like that. And so there's a lot of stress and trauma that's going on for children naturally, irrespective of the history they may have had in regards to neglect or abuse or other trauma. But there's often this sense of a negative self-sense. And what we know is the more positive a child's self-identity is, the more resilient they are, the more able they are to manage stresses rather than react to them. And early in the year we had Gregory Nicolau doing some training here, and one of the things he talked about was, he called it credits in the jar, or I call it pennies in the jar. These children have had a lot of negative information pushed on them about themselves, and to compensate with that we need to, at every opportunity, put credits in the jar, which means pay attention and acknowledge even the small things they do that are positive. And Gregory Nicolau talked about 25 to 50 a day. So it's looking for every opportunity. Even opportunity when they're not around. So the example he might give is, look, the child's come home and you might say to them, I was thinking about you today. I was remembering what we did last night and how great you were with that. And what that does is the child realises I'm even valued when I'm not at home, let alone when I am at home. And it's all assisting the child to feel better about themselves, but it also creates a buffer. The more positive they feel about themselves, the more resilient they are, the more they're able to manage stress or a negative statement or a change in circumstance when it happens. So it's recognising that the pennies in the jar is a really important factor in dealing with children with trauma, and seeking every opportunity to acknowledge positive aspects of their day. And what you'll find is with a more positive self-image, they're more robust, meaning they can handle changes, they can cope with a no, they can cope with things not going the way they want better than they would have done initially with a very negative sense of self. As I said before, trauma diminishes kids' social skills and often isolates them from peers. As I said before, one of the factors with that is this lack of memory, so that they don't learn. They don't learn. Learning is repetition. Learning is I do something one day and then I learn something, do something the next, and I adjust and learn over time. If their memory and learning is impaired, then they're not making those learnings, particularly in a social arena. The other aspect often is that they've been in an environment where there's been poor role models and poor social learning. So many of these kids are very unskilled at engaging with friends, engaging with peers, recognising who is a good friend, who isn't, and developing friendships. And one of our roles is to help them skill up in that area. Part of the skill up, as I said before, is improving memory. So we'll go into the aspect of it, but a useful technique with memory is for them to recall the day in order. So you talk to them about the day from beginning to end. And by them talking about it, they're bedding it into memory. And if it's bedded into memory, it's stuff that they can then recall later on. It's also useful to explore feelings as you go through that process, and any learnings that might occur. So it might be that his best mate Phil took his bag at school and teased him about it. So we can talk about that. We can talk about how he felt, but it might also telling him, so what's that say about Phil then? Is Phil a good friend of yours? Do you think Phil, you should hang around with Phil? It's trying to help them to learn, and to learn socially particularly. Because what I've found is a lot of kids with trauma gravitate to other kids that are troubled, and then you develop a rebellious nature, an anti-authority nature that makes it so much more difficult for kids to learn. The other thing to recognise is for kids with trauma, a classroom environment can be very difficult. Now we have an education system which is sort of a one-size-fits-all. Everyone has to sit in a classroom with 25 to 30 people and listen to a teacher. Now kids with trauma may have that difficulty, but they may also be overstimulated, or they may be sensitive to noise or people talking. They may have difficulty concentrating at the front of the class, and so it's important to engage with teachers, for teachers to be aware of if your child has trauma or has triggering, for the teacher to be aware of that and to assist. And the other thing I think is imperative is for teachers to do trauma training. Now, quite a few schools do trauma training, but a lot of schools are yet to do that. And you'll know the schools that have, because they have sort of techniques with kids that are overstimulated, where they may allow them to move to a less stimulating environment briefly, but then come back into the classroom. There's a lot of complicating factors with this. One factor I find frequently is some schools, in order to manage kids with trauma, allow them to be out of class too much of the time and find it easier to keep that going rather than try and reintroduce them into the class. So for a child with trauma, being in a class and being told what to do by a teacher is very, very difficult. And so it's understandable that there will be a lot of aggressive behaviour initially or difficulty sitting and concentrating. But I've been very conscious of schools actively trying to increase the percentage of in-class time for these kids rather than allowing them to be possibly even rewarded by their behaviour, by having them outside or sitting outside the principal's office. So she's saying here that it takes a number of years for an accurate profile of a child to be developed, and that's very true. And often the person with the most valuable information is the carer and the teacher, because they spend most of the time with the children, they're doing most of the observation of them. And it's important that the school engages with the carers to get the information that the carers will have around the child and a better understanding of their skills and deficits. So that this area of social engagement is really important. And as I said before, a lot of these children have created, have this behaviour of distrust, and so they'll actively create distance with people because they don't want to experience feeling vulnerable around people being too close. So there's a sort of protective nature that they may carry, which is I'll just keep away from people and not allow them to get too close, not talk about feelings, not allow the carer to engage with me very well. We'll just talk about it briefly, but there's a model that we call the sort of window of tolerance, and really it's a level of arousal. So it's knowing that we need to stay within what we call a window of tolerance for us to be able to communicate with the child and for them to be communicating with us and listening and learning. And so it's important to become more accurate in assessing where a child's arousal is at and what to do with those changes. So that if there's an ability to intercept before they flip their lid, it's good. If they flip their lid, then what do we have as a strategy to bring them back down again before we reconnect with them? So the window of tolerance talks about people who are too highly aroused, and this is the majority of the kids and young people we're talking about. At a high arousal level, they're either in an aggressive fight or flight state or they're in a freeze state. Either way, they're not listening or communicating. The other is sometimes there are some children who are in a submissive state where they've just closed down. It's not like they're frightened, they've just moved to a closed down state where they're non-communicative. You find that often with younger children, but it often is a trauma trigger. And it's important to recognise that and then seek assistance with it. So a key aim is to get them back into this window of tolerance. So the most common approach is to recognise, okay, they're getting close to flipping their lid, how can we bring them back down? Or they've flipped their lid, what do we do in response? So a child with regulated arousal, meaning that their arousal is at a moderate state, is more likely to engage with you and their peers and themselves. They'll have eye contact, speak clearly, get to task, change facial expressions, turn their head for listening, remain calm and be responsive. Now a dysregulated child may be more action-oriented, hypervigilant, impulsive, emotionally flooded, reactive, defensive and self-destructive. The issue to recognise is that when they're in this fight or flight response, there's no point trying to teach them stuff or tell them stuff. It is trying to create safety for them to bring their arousal down. And every child is different in regards to the strategies we do in relation to that. So just a couple of things, and this was applied with Gregory Nicolai's training. He talked about a moderate level of arousal where we may try to diffuse. So diffusion might be distraction, making a joke of things, or reducing stimulation so they don't get to the point where they flip their lid. But if they get to that point, then it's really trying to create a non-threatening environment. So me approaching a child, if a child's sitting down, is threatening. Me talking at the tone I'm talking would be threatening. So sometimes it's slowing speech down, getting down to their level, being very gentle with them. With some kids, it helps to touch them. I know some kids where I can put my hand on their shoulder, and there's a level of, you can call it submission, but there's a level where their arousal drops very quickly. You need safety with them first off, because that may trigger them if there's not that relationship there. But it's knowing that when they're in this dysregulated state, the key factor is to reduce arousal. And then at a later stage is to discuss with them, okay, what do we need to do? Where do we need to go from here? To engage them in thinking. So as I said before, when they're dysregulated, be less threatening, tone of voice, lower your position, but you're not trying to teach them or tell them anything at that stage because they're not responsive to that. The other thing that comes again from Gregory Nicolai's training, and also from the training from them, we had some experts from the States that came over, Dan Hughes earlier in the year, is we set the rhythm. Dan Hughes talks about setting the rhythm. And the rhythm is, communication is just to and fro. It's like a bird talking to the baby bird and talking back. There's a sort of a frequency of conversation. And there's a speed of speech. And partly for us, we can use that to bring kids down if they're starting to hype up. So we're trying to regulate their arousal by regulating our own. Because if I'm getting stressed with their stress, they're going to pick up on that. Now, kids with trauma pick up on the non-verbals. So I can say very nice things, but if I'm getting stressed, that's what they're going to pick up on more than anything else, and they're going to react to that. So trying to help them regulate their arousal is about us regulating ours. And we don't need to be super active with it. Gregory Nicolai talks about slowing our breathing down and letting them know that we're slowing our breathing down. I think that can be antagonistic at times. I think kids may take that the wrong way. But if we're slowing our talking down and consciously slowing our breathing down, then that's going to have an effect on the child. So what we need to do is be tuned into them so that when they start to dysregulate, we're trying to bring them back down again. But ultimately, we're trying to move to a point where they are able to self-regulate. And to self-regulate, they need to understand the things that we're talking about today. So that we need to learn them, but we also need to teach them about them as well. Because one of the things, I guess, with trauma is that trauma is often hardwired. So quite often traumatic memory doesn't fade with time. It doesn't disappear into the past like other memories can. So there may always be some triggering for these children, but working with them, we can help them to stay at a more moderate level where they can manage it better and not get to the point where they flip their lid and then they're unmanageable or they're self-destructive or a danger to themselves or others.